Most people believe that diabetes can only be caught by a blood test, but nobody actually tells you the complete truth. I need you to do something before we go any further. Press your fingers into the bottom of your foot. Right now, just do it. Press gently into the ball of your foot, hold it for 2 seconds, and release. Did you feel that clearly? Was the sensation sharp and immediate, exactly where you expected it to be? Or was it slightly off? A little dull, a little less than you expected, maybe slightly delayed? That small difference, the one most people dismiss without a second thought, can be one of the earliest signs that your blood sugar is already affecting your nerves. And the uncomfortable truth is that most people don't catch this until it becomes something much harder to manage. Not because they weren't paying attention, but because they didn't know what they were looking for. Stay with me because what I'm going to share with you today is information that most people never hear until it's too late to make a real difference. I'm Dr. Megan Foster. I've spent over 20 years in clinical practice, and in that time, I have had thousands of conversations about health, about prevention, about catching things early versus catching them late. And one of the most difficult conversations I have, the one that stays with me, is the one where someone sits across from me and says, I noticed something a few years ago, but I figured it was just getting older. Because by the time we're having that conversation, the window for the easiest intervention has often already closed. That conversation is exactly why I'm here today. Before we get into the signs, if you have someone in your life, a parent, a sibling, a spouse, a close friend, who you think might benefit from this information, please share this video with them right now. Don't wait until the end. The earlier someone has this, the more they can do with it. Now let's address the biggest misconception I encounter in my practice. And I see this constantly with patients of all ages and all backgrounds. People believe that diabetes begins the moment a blood test comes back with a number high enough for a doctor to say, you have diabetes. They believe there is a clear dividing line, healthy on one side, diabetic on the other, and that a lab result draws that line. That is not how this works, and that misunderstanding is one of the main reasons so many people miss the early window of opportunity. By the time your blood sugar numbers are high enough to trigger a formal diagnosis, the underlying process has often been quietly underway for years. The changes have been building slowly, without obvious dramatic symptoms. And the first place your body tends to show those early effects is not in a blood test. It is in your feet. Here is why your feet specifically. And this part matters. Your feet are the farthest point from your heart and your brain. The blood vessels that supply your feet are some of the longest and finest in your entire body. The nerves that run through them travel a greater distance than almost any other nerve. Now, the longer a nerve fiber is, the more of its surface is exposed to whatever is circulating in your bloodstream. When blood sugar is elevated, the nerves in your feet absorb more of the damaging effects than nerves anywhere else. They are first in line. There's something else worth knowing. Your feet have a relatively limited blood supply compared to more central parts of your body. Your heart, your lungs, your vital organs all receive circulatory priority. The extremities, especially the feet, work with what remains. So when circulation begins to be affected by elevated blood sugar, your feet feel it first because they are already operating with the smallest margin. I want you to do something right now. Not physical, just a mental exercise. Think back 3, 4, maybe 5 years. Do you remember how your feet felt? The immediate, clear sensation of stepping onto a cold floor in the morning. The fatigue of a long day, real and normal, but with sensation that was completely intact. Lying in bed at night without any strange or unexplained sensations that needed managing. Now come back to today. Has anything shifted? Maybe you move around more in bed before falling asleep. Maybe there are sensations you can't quite name. A vague warmth, a low-level buzzing, something intermittent that you've learned to accept. Maybe your feet just feel different from a few years ago, not dramatically, not in a way that ever sent you to a doctor, but different in a quiet, steady way you've stopped questioning. Most people chalk all of that up to getting older. That is the most natural conclusion to reach. But what if it isn't just aging? What if your body has been trying to communicate something important and you've been interpreting the signal as something it isn't? Here's what I need you to understand. This is not inevitability, and you are not powerless. Your body is designed to give you early warnings. Long before anything permanent happens, it sends signals. Small, quiet, easy to rationalize away, but real. The question is whether you know how to read them. Let me explain what's actually happening inside your body in a way that is clear regardless of your background. Think of your nerves like electrical wiring running throughout your body. Every nerve fiber has a protective coating around it, like the rubber insulation around a cable. That coating allows signals to travel cleanly, quickly, and accurately. It is what lets you feel exactly what you should feel, exactly where you should feel it. Now imagine elevated blood sugar acting like a slow, persistent irritant. Not sudden or dramatic, just consistent. Over time, with sustained exposure, it gradually wears down that protective coating in small areas, especially along the longest nerve fibers, the ones in your feet. When that coating is compromised, the signals don't travel cleanly anymore. They get distorted. And that distortion is what you experience as tingling, burning, numbness, or pain that seems to have no obvious source. Here's something most people never hear. Your body actually has two separate types of nerve fibers running through your feet. One type handles fine touch, light temperature changes, and delicate sensation. The other handles deeper pressure, stronger pain, and gross movement signals. Elevated blood sugar tends to damage the fine sensation fibers first. This is why one of the very earliest changes is a slight dulling of light touch and small temperature differences. While the ability to feel deep pressure might seem relatively normal for longer. That foot press test I had you do at the very start of this video is specifically designed to check fine sensation. Most people never test it. Most people assume that because they can walk normally and feel obvious things, their sensation must be fine. But it is the subtle, fine level sensation that goes first. And most people only notice it's gone once they're specifically looking for it. According to data from the American Diabetes Association, nearly 1 in 5 people with diabetes are not aware that they have it. And research consistently shows that nerve changes in the feet can begin years before a formal diagnosis is ever made. That means right now, millions of people are experiencing real physical symptoms and attributing them to aging or fatigue because they don't know what those symptoms are actually pointing to. Today, I'm going to change that for you. I'm going to walk you through 9 specific signs your feet may already be showing you. Ordered from the earliest and most subtle, all the way to the ones that, in my clinical practice, tell me this process has been underway for a significant amount of time. Stay with me all the way to sign number 1, because it is the most overlooked, the most commonly missed, and the most telling. It requires no pain, no unusual sensation. You have to look for it specifically, and when you find it, it tells you more about how long this has been building than almost anything else. As we go through each sign, if you recognize even one of these in yourself or someone you love, type yes in the comments. Not for me, for you. Naming what you recognize is the beginning of doing something about it. Let's begin. Sign number 9 is numbness or tingling. This is the one most people experience and immediately explain away. Your foot fell asleep. You shake it out, it goes away, you forget about it. And occasionally, when it happens in an obvious situation like sitting with your legs crossed too long, that's exactly what it is. Nothing to worry about. But when tingling or numbness becomes something that happens regularly without a clear positional cause, the picture changes entirely. Here is what is happening at the nerve level. The protective coating on your nerve fibers has begun to thin in certain places. As a result, the electrical signals those nerves carry start to leak slightly. Imagine a wire with worn insulation causing minor short circuits. Those short circuits register in your brain as that familiar pins and needles sensation. The nerve is still working, but it isn't working cleanly. Here is something that surprises most of my patients. Nerves communicate in both directions simultaneously. Signals travel from your feet up to your brain, bringing sensation information. And signals travel from your brain down to your feet, regulating things like local blood vessel tone and circulation. When that two-way communication is disrupted, it doesn't just affect what you feel, it begins to affect the entire local environment in the foot. How much blood reaches certain areas, how muscles respond, how efficiently the tissue maintains itself. All of this starts with what feels like a simple, harmless tingling. The most common mistake is dismissing it because it comes and goes. People assume intermittent means unimportant, but intermittent is almost always how early nerve involvement presents. It cycles. It comes and goes before it becomes constant. The fact that it keeps returning is exactly what matters, not the fact that it also goes away. When nerve involvement is caught at the intermittent and mild stage, there is a genuine opportunity. The earlier the underlying blood sugar issue is addressed, the more of the nerve coating can be protected. At this stage, partial recovery is genuinely possible. That window does not stay open indefinitely. There is actually a clinical test that doctors use called a monofilament test. A thin nylon fiber is pressed against the bottom of the foot, and the patient says whether they feel it. It sounds simple. But research shows that when people begin to lose the ability to detect that light touch consistently, their risk of developing foot complications increases significantly. The test only takes a minute. Most people have never had it done. And the reason I'm telling you this is that the self-check you did at the very start of this video, pressing your fingers into the bottom of your foot, is a basic, informal version of that same principle. You are checking whether fine touch sensation is intact. If it was slightly off, that is meaningful information. Sign number 8 is burning feet at night. This one genuinely catches people off guard because the sensation feels so real and so physical. Your feet feel hot, like they're burning from the inside. You kick off the blankets, you press your feet against the cool wall or the floor, but there is no actual heat source. The room is fine. No fever. Nothing explains it. Here's what is happening. Your nerves are misfiring. They are generating heat signals and sending them to your brain when there is no heat present. Think of it like a car alarm going off in an empty parking lot. No threat exists, but the system has a fault and the alarm is real. Here's something I find particularly interesting about this symptom that most people never hear. Burning feet at night tends to be worse specifically at night for a clear biological reason. During the day, you are moving, you are using your feet. Your nervous system is receiving constant real input, pressure, temperature changes, movement signals from dozens of different sources. All that genuine input partially masks the distorted signals coming from damaged nerve fibers. It competes with the noise. But at night, when you're still, when there is no external activity generating real signals, those distorted nerve signals have no competition. They become the loudest thing your nervous system is processing. The quiet amplifies them. This is why burning in the feet is so consistently reported at night. Not because the damage is worse at night, but because the absence of competing input makes the signal much more noticeable. People find all kinds of reasonable explanations for this: warm weather, a long day of walking, heavy socks, and sometimes those things do contribute at the margins. But when burning feet at night is a consistent pattern, when it happens across different seasons, different activity levels, different circumstances, that consistency is the real signal. Not any single night, but the pattern. Regular patterned burning in the feet at night is evidence of nerve damage progressing. Recognizing it at this stage gives you meaningful options. Sign number 7 is slow healing cuts or blisters. Everyone gets small wounds on their feet at some point. The question is not whether you get them, it's how efficiently your body handles them. A minor cut or blister that closes cleanly within a few days to a week is normal. One that is still open and unhealed 2 to 3 weeks later is not. Here is what is happening below the surface and why this sign matters as much as it does. When blood sugar is elevated over time, it damages the walls of tiny blood vessels, not just the large visible ones, the capillaries, the microscopic vessels that weave through your skin tissue and deliver everything your body needs to heal. Elevated blood sugar causes those walls to thicken and stiffen over time. Less blood passes through. Delivery to the tissue slows down. Now, healing is a remarkably complex biological process. Within minutes of a wound forming, your body initiates a precise sequence of events. Inflammation to clear debris, followed by new tissue formation, followed by remodeling and strengthening. Every single step of this sequence requires adequate blood delivery, oxygen for energy, nutrients for rebuilding, specialized immune cells to clear bacteria, chemical signals to coordinate the entire process. When blood delivery is compromised, every step slows. The wound stays open longer. And there's a second mechanism that compounds this problem. Elevated blood sugar directly impairs the function of white blood cells, the immune cells that protect an open wound from infection. These cells require glucose to fuel their activity, but ironically, too much glucose in the environment disrupts their signaling and reduces their effectiveness. So, not only is the blood supply reduced, but the defense system at the wound site is also weakened. The same minor blister that would be unremarkable in a healthy person can become a serious issue in a different internal environment. The wound is the same. The conditions around it are not. If you have a wound on your foot that isn't healing at a pace that makes sense, please don't give it another week. Sign number 6 is skin color changes. Look at your feet right now. Really look. The tops, the sides, your ankles, and lower legs. Are there areas that look darker than surrounding skin? Patches with a reddish or purplish tone, particularly around the ankles? Here is what those color changes actually reflect and why they happen. Your skin's color is partly determined by the blood flowing through the tiny vessels beneath it. When circulation is healthy and blood is fully oxygenated, skin maintains a relatively even tone. But when blood flow is disrupted, several visible changes occur. First, blood that moves slowly through small vessels loses more oxygen before returning to the lungs. Oxygen depleted blood has a darker, more purplish color than oxygenated blood. Areas with sluggish circulation can take on a darker or purplish tone as a result. Second, when blood pools in an area rather than flowing through efficiently, the buildup of certain breakdown products in the tissue causes brownish discoloration over time. This is a well-documented sign of poor lower limb circulation. Third, in some cases, the body tries to compensate for poor deep circulation by dilating surface blood vessels, which creates a reddish, almost flushed appearance at the skin level. All of these color changes are different expressions of the same underlying story, EO. That blood vessels in that area are not circulating efficiently. They are visible external signals of an internal circulation problem. And seeing them, knowing what you're looking at, means you can act on that information while the changes are still at the visible stage. Before we move to sign number 5, I want to take a moment to share something that I think fundamentally changes how people see this entire picture, and most people have never heard it put this way. We talk about blood sugar affecting nerves and circulation. But here's the deeper reason that happens, and it comes down to something called oxidative stress. When blood sugar is elevated, the cells throughout your body, including the cells lining your blood vessels and the cells that maintain your nerve fibers, work harder than they should to process all that extra glucose. That extra work generates what scientists call free radicals, unstable molecules that, in excess, damage the structures of cells. Think of it like engine friction. An engine running too hard for too long generates heat that damages its own components. Your cells, running in a high glucose environment, experience something similar. The damage accumulates slowly, cell by cell, vessel by vessel, nerve fiber by nerve fiber. This is one of the core biological reasons why the effects of elevated blood sugar build so gradually and so quietly, because they start at the cellular level, long before anything becomes visible or noticeable from the outside. Your feet show the earliest external evidence of something that has been building internally for a long time. Sign number 5 is cracked heels that won't improve. Cracked heels are very common and usually straightforward. Dry weather, certain shoes, hard floors, not moisturizing enough, all normal causes, all responsive to normal care. What I'm describing is distinctly different. Cracked heels that don't respond to care. You've moisturized consistently, changed your footwear, tried multiple approaches. Weeks pass, the cracking persists or worsens despite your effort. Here's the mechanism that most people never know about. Your skin is actually regulated by two systems working in parallel. One is external, products, moisture in the air, friction and pressure. The other is internal, a network of fine nerve fibers that send continuous instructions to the sweat and oil glands in your skin. These nerves tell those glands exactly how much moisture to release, when to release it, and in response to what conditions. It is a precise, ongoing process that happens completely below your level of awareness. When those fine nerve fibers are damaged, which happens relatively early in the course of nerve involvement, that internal regulation breaks down. The glands stop receiving the signal. They reduce production. The skin begins to dry from the inside, regardless of what is applied to the outside. And because the instruction system is disrupted, external products can only do so much. The skin keeps cracking because the signal that prevents cracking is no longer getting through. You may also notice that this type of skin looks different from ordinary dry skin. Normal dry skin tends to crack along stress lines and responds to moisturizer within a few days. Nerve-related skin dryness often has a different quality. The skin may appear unusually tight, almost shiny in places, and it simply does not respond to moisture the way you'd expect. That non-responsiveness is itself a useful signal. And beyond appearance, those cracks create entry points in the skin. For someone with compromised circulation and a reduced immune response at the wound site, those entry points carry real risk. A crack in the heel that becomes infected is not a small matter in this context. Sign number 4 is swelling in the feet or ankles. We've all had puffy feet. After a long flight, after hours of standing, at the end of a hot summer day, temporary, normal, resolves with rest. What I'm describing is a different quality entirely. Swelling that is there when you wake up before you've done anything. Swelling that doesn't fully resolve after a full night of rest. Consistent, returning in the same place without a clear cause you can point to. Let me explain the kidney connection because this is something most people genuinely don't know. One of the earliest organs affected by chronically elevated blood sugar is the kidney. Your kidneys filter your entire blood volume approximately 40 to 50 times every single day. They do this through millions of tiny filtering structures. And those structures are extremely sensitive to blood sugar levels. When blood sugar is elevated over time, those filtering units begin to be damaged. They become less selective. They start letting proteins pass through into the urine when they shouldn't. Here is why that matters for swelling. Proteins in the blood, particularly one called albumin, help the blood hold onto water. They act like a sponge inside your blood vessels, keeping fluid where it belongs. When those proteins leak out into the urine, the blood loses some of its ability to hold water. That water moves out of the vessels and into the surrounding tissue. And because of gravity, the feet and ankles are where it accumulates first. This is why persistent, unexplained foot and ankle swelling can signal kidney stress, even before a kidney test shows a clearly abnormal result. There's also a second mechanism at work. Elevated blood sugar damages the nerve fibers that regulate blood vessel tone in the lower legs. When those regulatory nerves are disrupted, small blood vessels dilate more than they should, allowing fluid to leak into surrounding tissue more easily than normal. Two separate mechanisms, one visible result, swelling that doesn't resolve the way it should. When the innocent explanations don't fully account for swelling that is there every morning, that is consistent, that has become something you expect. That consistency is worth taking seriously. Here is something worth understanding about blood sugar and your feet specifically, something that often surprises people when they hear it for the first time. Many of the early changes we're discussing today are happening in what doctors call the microcirculation. The macrocirculation, the large vessels you can feel a pulse in, the arteries your doctor checks during a physical exam, those may still appear relatively healthy even while the smaller, finer vessels deep in the tissue are already being affected. This is one of the reasons early foot signs matter so much. A standard cardiovascular checkup may not reveal what is happening in the microscopic vessels in your feet. The feet are one of the few places where microcirculation changes can be observed and inferred directly through the skin changes, the sensation changes, the healing changes, the signs we're talking about today. They give you a window into a part of your circulation that standard tests often miss. Now I want to pause because the next three signs are the ones I respond to most directly in clinical practice. The first four are important. They deserve attention and follow up. But the next three tell me the process has been building for longer, and they represent a shift in the level of urgency. If you've recognized anything so far, stay with me for this part. Sign number three is sharp or stabbing pain, not soreness, not tired feet. I'm describing pain that is sharp, sudden, and electric. Pain that shoots through the bottom of your foot without warning. Pain that jolts up your leg. Pain that may wake you from sleep. Pain that arrives and disappears without any logical pattern. Here's what creates this specific type of pain and why understanding it matters. When nerve damage progresses past the early stages, nerve fibers can develop what is called sensitization. The threshold for firing, the minimum signal strength needed to trigger the nerve, drops significantly. A normal nerve only fires when it receives a signal strong enough to warrant it. A sensitized nerve fires with almost no provocation at all. It begins generating electrical signals spontaneously, without any real trigger from the outside, and sends them to the brain as intense pain. This is why the pain feels so sudden, so sharp, and so unexplainable. Nothing visibly wrong happened. No impact, no pressure, no injury. But the internal electrical system is generating alarm signals on its own. The experience of the pain is completely real. The electrical signal is completely real. The cause of it is inside the nervous system itself, not in any external event. What is critical to understand is that standard pain relievers don't address this. They manage the experience of the signal. They quiet the alarm in your awareness, but they do nothing to address the sensitized nerve generating it. The underlying process continues. People can spend years managing this kind of pain without knowing that what they're dealing with requires a fundamentally different approach. If you're experiencing sharp, electric, sudden pain in your feet or legs, especially at night, please don't just manage it. It needs a thorough evaluation. Sign number two is persistently cold feet. Not cold from weather, not cold from thin socks, cold in a warm room, cold under heavy blankets. Cold that doesn't warm up the way it used to.